Hello, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and founder of the website betterhealthwhileaging.net. And this is the Better Health While Aging video podcast, where we discuss common health problems that affect people over the age of 60 and the best ways to prevent and manage those problems. In today's episode, I'm going to talk about a very important issue in geriatrics, and that is how to prevent falls in later life. As you probably know, falls become much more common as people get older, and they can sometimes cause serious injuries, such as hip fractures or head injuries. Frequent falls can also be a reason that an older person ends up needing to move out of their longtime home. At a minimum, falls can be embarrassing, and sometimes fear of falling can limit what people do and how they get out in the world. So for us in geriatrics, fall prevention is really important when it comes to helping older adults maintain well-being and independence, and we focus on this a lot in our practice. So in this episode, I'm going to walk you through how I think about fall prevention, and I'll share a few key approaches that geriatricians use with most older adults, because I think knowing the basics about fall prevention is something really important that every older adult and family should know something about. So specifically, in this episode, I'm going to start by talking about why do older adults fall and how to think about why a specific older person might be falling. And I'm going to talk about the idea of fall risk factors versus the actual fall triggers. And then I'm going to talk about the medical evaluation of falls, like why it's important, what it should include. I'm going to share with you my top ways to prevent falls, the strategies that I use the most often because they apply to the most people. And then I'm going to finish with some tips on what you can do if you're concerned about falls for yourself or for someone else. So we're going to get to that. But before I do, I have a very quick request, which is that if you are here and you find this topic interesting, or if you've been finding my video podcast interesting, if you haven't subscribed yet, if you could please go ahead and subscribe, it would really mean a lot to me. It does help me out. It helps other people find the channel when you subscribe, and it helps support the work that I'm doing. Another option, if you appreciate my making these videos, is to become a member of this Better Health While Aging YouTube channel. And to learn more about that, just click the join button under this video. Okay, moving on. So, what triggers a fall? So here's a little graphic that I made years ago to kind of illustrate how I think of it. And basically, a fall happens when we experience a challenge to our balance or strength. It's often a sudden challenge, a moment of instability or being off balance, and that challenge is greater. It overwhelms our current ability to stay upright. So the human body, you may have noticed most mammals are four-legged. We are up on two legs. That's inherently a little bit less stable. And so part of our life as humans is to often be challenging our balance a little bit by leaning over, by turning around, or maybe by stumbling. Sometimes we're pushed. And the body is equipped to have all these mechanisms so that we can catch ourselves and recover our balance. That's our ability to stay on our feet. So if we get enough of a stimulus that is big enough that it overwhelms our ability to stay on our feet, we fall. So when we're younger, we have lots of ability to stay on our feet. So it really takes a big push or stumble for us to fall. But as we get older, that ability, those mechanisms we use to stay on our feet, tend to work less well for a variety of reasons that I'll get into. And so it becomes easier to fall. So why do older adults fall? Again, as we get older, that ability to recover our balance and stability tends to decline. Some of the reasons for this. One of the main ones is that as we get older, we tend to lose muscle strength unless we become really actively involved in trying to maintain it through strength training. We now know in geriatrics that strength training is one of the most important things that people can do to maintain mobility, independence, and quality of life. If you want to learn more about that, I have a video all about how to exercise in aging. So losing muscle strength in our core, in our legs, will make us at higher risk for falls. Another issue that comes up for a lot of older adults is that the blood pressure can drop, at least temporarily, when we stand up. This is called orthostatic hypotension. Becomes very common as we get older, especially if people are also taking medications for blood pressure or other medications that might affect their blood pressure. And if you want to know more about that, I have a video all about low blood pressure that goes into that in depth. But that moment when the blood pressure drops, when people stand up, they can feel lightheaded, woozy, and they're at higher risk for a fall. And then also, as people get older, it can be fairly easy to have your nerve function or your muscle coordination impaired by various chronic conditions. Sometimes these are conditions that really affect the nerves in our feet or our legs, such as peripheral neuropathy. Other times, it might be something going on in the brain that is affecting our ability to rapidly coordinate our reflexes and our ability to stay upright. And then also, as we get older, we tend to develop other health related factors that can create increased fall risk. So these include being on medications that affect balance or blood pressure. These include vision changes, such as developing cataracts or other forms of vision impairment. And then there's a whole variety of chronic conditions that are also associated with increased fall risk, including things like incontinence, depression, neurological conditions, even some heart conditions, and more. So that's part of why we fall. So to prevent falls, I find it really helpful to kind of be able to think about what are a person's risk factors and what are their fall triggers. So for risk factors, we can often group them into actually two types. One type is sort of person based and related to health, and the other type is related to the environment. So some examples of health based risks might include having balance problems for a variety of reasons, having weak muscles, vision problems, having those chronic diseases that are associated with increased falls, or being on medications. Then we have environmental risks. These are things outside the person, but they still create a risk of falling. So these might include things like home hazards, like slippery floors or loose rugs, or poorly lit spaces at night. They might include outside hazards, snow, ice, uneven sidewalks, steep hills in some cases. And we also usually group poor footwear in there. So sometimes older adults are wearing footwear that doesn't have a nice stable sole that might slide around on their foot. Maybe has a slippery sole. Maybe is a really high heel at a time that one doesn't have quite the balance and stability that one used to have. Those would be some examples of environmental risks. So those are the risk factors, things that put you at increased risk for a fall. But it takes more than that to actually fall. You also need a trigger. So here are a couple common triggers that I see causing falls. They include things like, tripping, stumbling, having a new illness that makes you feel weak or unwell, or having a dizzy spell for some other reason. It could be due to overexertion. It could be due to heat. It could be due to dehydration. Another potential trigger is alcohol, which, as I think we all know, does affect balance and stability. And so, especially as we get older, that can be more likely to cause a fall. So, when people fall, especially older adults, they usually have some of these health based risks. They may have environmental risks as well. And then there's a trigger moment, and that results in the fall. So, a couple more things I want to share about aging and falls. People generally want to know, how do I prevent a fall? Or I've been falling, or my loved one has been falling. How do we prevent falls? And what's important to know is that usually there's no single smoking gun reason why somebody fell. When it comes to older adults, falls are almost always multifactorial. So usually people have multiple health based risks and maybe some environmental risks as well that are going on. So there are usually several risk factors contributing to a fall, and some may be easier to modify than others. So, for instance, if somebody has a chronic condition, such as Parkinson's, that can sometimes be treated for better motor function, but generally cannot totally be cured. Same thing goes with peripheral neuropathy. That's often a chronic condition that cannot be entirely reversed. But then people may have some other risk factors that maybe we can modify or change, such as their medications, or maybe we can help them get stronger. So if an older person falls, I feel it's really important that they get a good evaluation to check for common underlying causes and risk factors. Now, there are some strategies for fall prevention that tend to work in almost every older adult. I'm going to share those with you in a moment in this episode. But also, it's important to sort of take a good look at that specific person to better understand what specifically happened or is happening with this person that is putting them at higher risk for falls or causing their falls. So we want to try to identify for each individual what are their main risk factors, what are their triggers, and then how can we modify those so that they don't fall as often or hopefully not at all. What's really important is to not just attribute falls to getting old. That's really basically kind of ageist, and it's missing an opportunity to really help people. Yes, as we get older, we're more likely to have the things happen to us that create increased fall risk. But older adults sometimes are waving off a fall evaluation. They don't want to trouble anyone, or they may be embarrassed about it, or they may feel like there's nothing to do. This is just part of getting old. And so I really want to push back against that. There are often things to do. And so I really encourage that medical evaluation. And in fact, right after somebody has had a fall is a great moment to take a good look at what might be going on with them and try to understand that fall, because one of the highest predictors of falling is having had a recent fall. So I actually have a list of 8 things that I check after a fall that I think doctors should check. I have a video on it, or if you prefer to read, an article on better health while aging, and I will have a link to that in the replay notes for this episode. So, if you're worried about fall prevention, or maybe you've had a fall, what should your health providers be doing? Let's talk a little bit about that. So, first of all, whether or not you report a fall, all the expert guidelines highly recommend that health providers regularly screen older adults for falls. The recommendation is that older adults be screened yearly and by being asked 3 questions. One, have you fallen in the past year? 2, do you feel unsteady when standing or walking? And 3, do you worry about falling? So if an older adult says yes to any of these, it's highly recommended that they get more evaluation for fall prevention. And I'm going to take you through what that evaluation should cover. Another option that is recommended for health providers, and this is a tool that you yourself can use, is to go through the questionnaire that is included in the CDC's Stay Independent brochure. So let me show you this right now. Several years ago, the CDC did a big fall prevention public health project called STEADI. And as part of that, they created lots of great resources, both for health providers, but also for older adults and families themselves. So let me show you the Stay Independent brochure and the questions that are in it. So here's the CDC's Stay Independent brochure. There are 4 things that they recommend are speak up, keep moving, get an annual eye exam, make your home safer. Those are good suggestions. I just think we can go a little further, and I'm going to teach you some additional things you can do. But what I really wanted to show you was that they have this nice questionnaire here to help you check your risk for falling. So these are yes, no statements for older adults to go through. And they include statements like, I have fallen in the past year. I use or have been advised to use a cane or walker to get around safely. Sometimes I feel unsteady when I'm walking. I steady myself by holding onto furniture when walking at home. I'm worried about falling. I need to push with my hands to stand up from a chair. I have some trouble stepping up onto a curb. I often have to rush to the toilet. I have lost some feeling in my feet. I take medicine that sometimes makes me lightheaded or more tired than usual. I take medicine to help me sleep or improve my mood. And lastly, I often feel sad or depressed. So if you answer yes to 4 or more of these questions, that's associated with being at higher risk for falling, and it becomes especially important to bring this up and talk with a health provider. So that's what the screening is supposed to involve. And again, if an older person reports a fall in the past year or seems to be at risk, then providers should continue with a medical evaluation for fall prevention. So now let's talk about what that evaluation should include. And for this, the CDC also has an algorithm on their website, the STEADI algorithm that lists these steps. And I'll post a link to that algorithm in the replay notes. But basically, first and foremost, they recommend that the health providers evaluate the older person's gait, strength, and balance. So gait means the way the person walks. So at a minimum, that means watching the person get up in the exam room and kind of walk across the room and back, or maybe watching them walk down the hallway. There are some additional tests that can be done in the primary care office. The providers may or may not do them. Some of them will just refer directly to physical therapy for a more thorough evaluation. But those tests are the timed up and go, the 30-second chair stand, and the 4-stage balance test. And if you want to see what these look like, let me share a resource that I have on Better Health While Aging, where you can watch a short video and also access a CDC resource to take you through what these look like. So this is a page I created years ago on Better Health While Aging, collecting some YouTube videos that illustrate Otago exercises for fall prevention. They are from the Carolina Geriatric Education Center at the University of North Carolina, Chapel Hill. And here you can see what these little assessment tests look like. And I also have links to the CDC clinician references. So in the timed up and go, an older person is asked to stand up from a chair, walk a distance of 3 meters, turn around, come back and sit back down. And that process is timed. And if the time it takes them is longer than a certain cutoff, that is associated with a higher risk for falls. Basically, people who are slower generally are going to be weaker and they're going to be at higher risk for falls. Another test is the 30-second chair stand test, where older adults are asked to stand up as many times as possible from a chair without using their arms in 30 seconds. And then there's a 4-stage balance test, where they're asked to stand in different poses with their feet, first with your feet next to each other, and then one a little bit in front of the other, and then in tandem. And there's a 4th stage, and that sort of tests their balance. So these 3 tests are relatively simple to do, can be done in the primary care office, and if nothing else, provide, not only a sign of who's at higher risk for falls, but also a bit of a benchmark of what is this older person's strength and balance like right now. Because maybe if they do exercises and we reassess them after a certain time period, we'll see that they've gotten better. And that can be very satisfying for everybody involved to see that there's been that improvement. Okay, so that would be the evaluation of gait, strength, and balance. And then the health providers should also assess a few other things. So another thing they should do is review medications and identify those that increase fall risk. And so I'm going to do an upcoming episode where I go into these medications in depth. But briefly, they are medications. A lot of the medications that affect memory also affect balance. So things like anticholinergics, sedatives, and there are a few others. I also have an article on Better Health While Aging of medications that increase fall risk, and I'll share a link to that. These are also listed in the Beers criteria, which I recently covered on the podcast as well. There's a table that includes a list of medications that one should be careful about if there has been any concern for falls. Another thing to do is to measure orthostatic blood pressure, which means measuring blood pressure sitting and standing to see if there is a significant drop in blood pressure when one changes position. Again, this is very common, and I go more in depth into this in my episode on low blood pressure. Additional things that are recommended are to at least check on vision, inquire whether the older person is having any difficulties with vision, or maybe do a basic vision test in the primary care office. Assess the person's feet, the sensation in their feet, how their feet are looking, what their footwear is, and then ask about home hazards and what is going on in the home. So lastly, this isn't specifically about fall prevention, but especially if it is a woman who has been having falls, we want to think about whether this person has been screened for osteoporosis, which is a very common condition where the bones become thinner. Why? Because people with osteoporosis, when they fall, they are especially likely to fracture something, and it can potentially be a significant fracture, such as a hip fracture. So that's the basics of the evaluation. And so based on what is found during this evaluation, this should identify significant risk for falls, and then we can make a plan for that individual person on how we can try to modify those risks and reduce them, and then also hopefully reduce activities that tend to create triggers. So everybody's fall prevention plan should really be customized to them, but I want to share now some of the top ways, the ways that we use the most often to prevent falls in older adults. So probably number one is to improve strength and balance through structured exercises. It is very, very common when an older adult has been falling for us to find that their leg strength is not super good, or that they are having some balance issues. So how do we modify that? It turns out that lots of randomized studies have shown that when people do a structured program, designed to help them improve their leg strength and their balance. Their strength and balance improve, and also they do reduce their falls as well. The best way to do this is to refer somebody to physical therapy. A well-studied program is Otago. And so on that page I had where I was showing the assessment exercises, I also have additional videos that show the kinds of exercises, both for strength and balance, that are done in Otago. If you've been having falls, I really recommend working with a physical therapist who can kind of customize the program and help you choose some exercises to start with and level them up. But if you just want to take a look to see what are the types of exercises that help with strength and balance, looking at those videos should be helpful to you. And then there are some other forms of exercise that have also been shown to help people with strength and balance. Tai Chi has been studied a fair bit and has a quite good track record. And then there are a few other proven programs as well. And the National Council on Aging has a very helpful section of their website, including a page that lists programs that have been specifically studied and shown to be effective. And so I'll share a link to that as well in the replay notes. So those are some ideas for improving strength and balance, and just about everybody benefits from working on their strength and balance when it comes to fall prevention. And then there are a couple other things that we do very often in geriatrics. So another one would be deprescribed medications that affect balance and falls. So we want to first identify them, and then we want to see, can we taper them off? Can we switch to a safer option? Or can we at least reduce the dose? Because every bit of reduction hopefully will help. If the issue is that the person was having orthostatic blood pressure changes when we checked, then we might also want to consider reducing the blood pressure medications as well, and maybe allowing the person to have a slightly higher blood pressure goal. And I do talk more about blood pressure goals in my videos about treating high blood pressure. If there's any sign that vision might be impaired, we want to refer people to an eye doctor to get that further evaluated. It has been shown that if people have significant cataracts, in some studies, having the cataract surgically corrected can reduce falls. And then if it's possible, if it's available, a home safety evaluation can be very helpful as well. The studies show that the best home safety evaluations are actually done by trained occupational therapists. So those are the top strategies that I find myself turning to when it comes to fall prevention. Now, I want to speak to another approach because people sometimes ask about it, and it is relevant, which is, what about mobility aids? So mobility aids means devices such as canes and walkers. Can those reduce falls? And the answer is sometimes. Sometimes, if the situation is appropriate and if they're appropriately used. Basically, for a cane or a walker to be effective, it first of all has to be the right device for a person's health or mobility situation. So canes, for instance, are best used to help take weight off of a limb that is weak or painful, and they need to be used correctly. Walkers provide more stability for sure than canes, but also need to be properly fitted and properly used. So those are the criteria really. Is it appropriate for the person's situation? Are they properly fitted? Are they properly used? And properly used is often a matter of coaching the person on how to use it, but also, does the person have the capacity to use this device correctly? And this is something that comes up, especially if people have developed a problem with their memory or thinking, such as Alzheimer's or another form of dementia. That can make it harder for them to use a mobility device correctly and safely. So if there have been falls, it can be very appropriate to consider a mobility device. And the experts in these mobility aids is actually physical therapy. They are the experts in assessing a person, in advising on what's the correct device, in making sure a person gets properly fitted, and in also providing the education and coaching. So yet another reason to involve physical therapy if there have been concerns about falls. So given all that, I just want to briefly summarize, in that case, my approach to fall prevention for older adults. Basically, especially if there have been recent falls, I do first try to make a little list. What are the risk factors for this particular person? And what are the triggers again? So, what are like the moments that are causing the fall? Are they mostly inside? Are they mostly outside? Are they related to position changes? That I think can be like really helpful in making a plan to reduce falls for a particular person. And I look for common underlying causes, including something new, right? There could be a new medical problem, like a new illness, or a new cause of weakness and lightheadedness, such as new or worse anemia. So, all of these things that I check for, I do list in my article and video, 8 things to check after a fall. And then I focus on the modifiable risk factors. And again, the most common ones are trying to improve somebody's strength and balance through referral to physical therapy in most cases. If there is a drop in blood pressure with a position change, what we call orthostatic hypotension, then we might try to modify medications or at least advise the person to change positions carefully, kind of hang on to something for a moment before they keep moving along. I definitely look at medications and identify the ones that are associated with poor balance or falls and think about reducing them or stopping them if at all possible. We do usually talk about the environment. So, this is when, again, like the question of where are they falling, what's going on is important. If we can modify that environment and make it safer, if issues have been in the bathroom, grab bars can be very, very helpful. If it's a slippery floor or related to trip hazards, removing those can be very helpful as well. If it's outside in the wintertime, thinking about some strategies for that. And then also part of my approach is that if there is another fall, especially if it seems different than the ones we had been dealing with, it's to check for new or worse problems, right? People do develop new or worse health problems that are affecting their falls. And so they might need just a recheck for those common causes. There might be something new that has come up that is now causing falls. Every now and then an older person falls because actually they've developed a new illness and we need to know about it. And then I also think about, well, if they do fall, how can we reduce the risk of injury? And for that, I think about 2 things. One is if they fall, many older adults, especially once they get older, into their 80s and 90s, have difficulty getting up after a fall. And so if they fall, how will they get help? How will somebody know that they fell and be able to check on them? So do we have a plan so that they're able to get help or that they can get a little bit of monitoring if it's somebody who lives home alone? Could they potentially wear a fall alert device? Smartwatches, actually, nowadays, almost all of them have fall detection technology. Or do we have a sort of routine for them where someone is checking on them regularly, making sure they're okay? And then can we reduce the risk of fracture if there's a fall? And the main way that we do that right now is by making sure that women or men who are likely to be at high risk, that they've been screened for osteoporosis. And if they have osteoporosis, that they've been treated to strengthen their bones because randomized trials have shown that osteoporosis treatment does reduce fractures. So, given all that, what should you do if you're concerned about falls or want to prevent falls? So, one starting point for you is to take a look at that CDC Stay Independent Fall Risk Questionnaire and go through it. And then, if you say yes to more than 4 questions, or if you've had a fall, or if you feel unsteady or find yourself worried about falling, talk to your health provider. I just can't recommend it enough. Let them know if you've had a fall or feel unsteady and ask for their assistance in doing that evaluation and making a plan to help you reduce your fall risk. Because you might need something like a referral to physical therapy, or a change in medication, or a vision follow up, or maybe a home safety evaluation, or maybe what you need is some other risk factor or health condition addressed to reduce your fall risk. Otherwise, the other thing to do, even if you've been feeling like pretty well and not having falls, is do what you can to maintain your strength and balance. It's really important to know that walking is not enough. If the only exercise an older person gets is walking, that is generally not enough to maintain muscle strength as we get older, especially as we get into our 70s, 80s, or 90s. To maintain that strength, you really have to do exercises that very intentionally challenge your legs and also your core to a certain extent and help you maintain strength. So you can strength train, you can do specific physical therapy routines, or you can enroll in a program that is specifically oriented towards fall prevention. And so you want to focus on core strength, um, you want to focus on leg strength, but also on core strength. Core strength is important for balance, and then also work on balance exercises. Exercises to maintain flexibility are also helpful. They haven't been shown to be helpful in quite the same way that the leg strength and balance exercises have been, but they are certainly helpful in terms of ability to get down to the floor and get back up to the floor. So I recommend those as well. And then some activities that tend to help people with this type of exercise include Tai Chi, yoga, and dancing as well. That said, you want to be safe. So, especially if you've had falls or concerns about your balance, it's best to start new exercises under supervision. Because otherwise, if you've been having falls or have been unsteady, trying something like Tai Chi or yoga, you could actually get injured. So, if you've had concerns, it may be best to first start with physical therapy and then transition to a less supervised form of exercise. And so that's what I have for falls. So, with that, thank you so much for watching. I hope this has helped you think about fall prevention and will help you keep yourself safer. So, if you found this video podcast helpful, if you're here on YouTube, please go ahead and subscribe. It does help more people find the channel. If you've been listening to the audio version on the podcast feed, come and take a look at the video. If you get a chance, you'll see my key points being displayed on the screen. And another option, of course, to support the podcast is to join as a member as well. There's a join button under this video. So thank you once again, and I look forward to seeing you all again on a future episode of the Better Health While Aging video podcast.